Patients taking medications in high-risk drug classes may be subject to side effects that can adversely affect health, safety, and quality of life. The basis for coding N0415 high-risk drug classes, use and indication, is determining whether a patient is taking any prescribed medications in the specific drug classes, and whether the patient-specific indication was noted for all medications in the drug class. What does taking a medication mean in the context of this item? The coding of column 1, is taking, identifies medications in the specified drug classes that are a part of the patient's current reconciled drug regimen and are taken only once or not at all during the assessment period, or given every few weeks or monthly, like long-acting medications, administered by any route, taken in any setting while a patient of the facility or agency. And for home health includes newly prescribed medications, even if the medication is not yet in the home or the first dose has not been taken. It is important to code medications according to the medication's therapeutic category or pharmacological classification, regardless of why the patient is taking it. And note that combination medications should be coded in all categories or drug classes that constitute the combination. Now let's examine what column 2, indication noted, means. How can we determine if there is a patient-specific indication documented for the prescribed medications that the patient is taking? Let's start by understanding what is meant by indication. An indication is the identified, documented clinical rationale for administering a medication that is based upon a physician's or prescriber's assessment of the patient's condition and therapeutic goals. Review patient documentation to determine if there are documented patient-specific indications for all medications in a specified drug class, and if so, check column 2, indication noted. Let's look at a scenario to understand this key concept for coding N0415. Your patient is taking prochlorperazine, classified as both an antiemetic and antipsychotic. The medical record states the patient-specific indication is post-operative nausea. The patient is taking no other antipsychotic medications. To code this medication in column 1 is taking. Check the box for antipsychotic. Antiemetic is not listed as a coding option. In column 2, check indication noted, since an indication is noted in the medical record for prochlorperazine, for post-op nausea, and this is the only antipsychotic medication that the patient is taking. Let's think about another scenario. Your patient is taking Percodan, and the indication of severe knee pain is noted in the medical record. Percodan is a combination medication, oxycodone and aspirin, classified as both an opioid and antiplatelet. The patient is not taking any other opioid or antiplatelet medications. To code this medication in column 1 is taking, check the boxes for both opioid and antiplatelet. In column 2, check indication noted for both classes, opioid and antiplatelet. Let's review. N0415 identifies if the patient is taking any prescribed medications in the specified drug classes, and whether the patient-specific indication was noted for all medications in the drug class. Code medications that a patient is taking based on the classification of the medication, regardless of why the patient is taking it. Thank you for reviewing. For more information, please consult the OASIS N0415 or LCDS manual.